When it comes to global health, there is no them, only us. What we need to think about is the contribution that we can have towards community health. Good evening and a warm welcome to all the viewers on today's session of the Doctor's Desk. My name is Dr. Narayani. I am a gynecologist from Mumbai. I have with me my co host, Dr. Dilshani.
Hi, I'm Dr. Dilshani. I'm a medical practitioner in Sri Lanka, specializing in community health resilience.
Hello, Dr. Dilshani.
Very happy to be here, especially with my earlier professor, Dr. Pandav.
Right. History tells us that an informed, activated population is vital to protecting the public's health. Keeping this in mind, I would like to introduce our eminent guest for tonight. He is a Padmashree awardee, the former head of Department of Community Medicine of All India Institute of Medical Sciences, New Delhi, for 45 years. He is also popularly known as the Iodine Man of India for his contribution in the prevention of iodine deficiency disorders as the founding member and president of Indian Coalition for Control of Iodine Deficiency Disorders in India. He has also been awarded the title of World Health Organization Public Health Champion in 2017. I would like to extend a very warm welcome to Dr. Chandrakant Pandav.
Namaste, namaskar, namaskaram.
Welcome,
Very
sir.
good evening to all of you. Thank you very much, Shukriya. Mucho gracias. Shiye, Dhanyavad, Shukrana, Shukriya.
So, thank you so much for gracing us with your presence. Thank you for taking out time from your very busy schedule to be here.
Narayani, this is equally important.
Yes, sir, absolutely. Because right now, as everybody knows, we are going through one of the worst phases that we have been in the entire pandemic, right from the first wave to the second wave. Sir, I would like to ask you first and foremost that about the shortage of vaccines and the unavailability of slots for vaccination has been a huge hurdle in the whole vaccination process. So, according to you, can we maximize the reach of the vaccination program in India?
Let me put your question in a context, Dr. Narayani. Let me put it in a context. You see, the tragedy of this so-called I'm using the word so-called pandemic of corona. The tragedy is it's exaggerated. It is a pandemic of fear. It is a pandemic of anxiety. And when you talk, it's being handled as a more of a clinical pandemic rather than a public health pandemic. I repeat again, Dr. Narayani, the pandemic all over the world is handled like a clinical problem. That's only a tip of the iceberg. It's not being handled as a public health problem at all. In community
Yes.
medicine, the basic concept is there are three types of prevention: primary prevention, secondary prevention, and tertiary prevention. Primary prevention has two components: health promotion and specific protection. The question that you raised about vaccine comes in specific protection.
Yes.
The second is secondary prevention, which focuses on early diagnosis and treatment. And this particular aspect has taken all the time, energy, only focusing on early diagnosis and treatment. So far, we have very conveniently, I'm using the word conveniently, ignored the first part. And the third part is tertiary prevention. There are two levels of intervention: disability limitation and rehabilitation.
Yes.
Now, your question, Dr. Narayani, fits into the primary prevention. The two interventions I mentioned are health promotion and specific protection. When it comes to vaccine, it comes into this category of specific protection. Now, your question is what to do with the shortage. I belong to the school where I learned prior planning prevents poor performance. I repeat, these are Dr. Pandav's 5 Ps. Prior planning prevents poor performance. I hope you got the answer in my answer. Prior planning prevents poor performance. And what I personally feel very strongly that by Indian Public Health Association, of which I was the president for 3 years and vice president for 6 years, we have come out with a statement, very first statement. The whole issue of lockout is the most arbitrary intervention that has taken place. Most arbitrary. When you talk of medicine these days, we talk of evidence-based medicine. But we seem to be focusing on eminence-based medicine. Where is the evidence that lockout has made a difference? We don't have an evidence. So it's the most last year I gave an interview, it was to CNBC on 5th of June. Nothing has changed. Nothing has changed. Dr. Narayani, nothing has changed. I said that this is the pandemic of misinformation, disinformation, incomplete information, pandemic of fear, anxiety, which is worse than the disease. That's what we are seeing in this entire pandemic. And finally, I want to say, Dr. Narayani, what is the attributable percentage of cause of death due to corona? Do you know the figures? What is the attributable mortality to corona globally? It's 2%. 2%.
2%.
And we have conveniently, I'm using the word conveniently, ignored the 98% cause of death. What is this? I find it very devastating. I think we have mortgaged our common sense. I'm using the word common sense. It is a pandemic to me of nonsense. Of nonsense. We have mortgaged common sense.
So absolutely, sorry, please go on, sir.
Bataiye, first your question.
So
Yes, ma'am.
absolutely what you said is correct because we have observed as healthcare professionals that due to COVID, all of the other health services have suffered because of arbitrary COVID protocols and the standard operative procedures have not been well planned. So all healthcare facilities have suffered. A lot of patients have ended up suffering very dire consequences because of the lack of healthcare in other aspects because of the entire pandemic situation.
Sorry to say, I find it draconian. I find this whole business draconian.
Exactly. Yes. Dr. Dilshani, the next question.
Yes, sir. If I may continue on with Dr. Narayani's question and the answer you gave in terms of the collateral damage of what COVID had in terms of the other diseases, which are other healthcare systems which have become vulnerable and where people have not been able to access healthcare for their other ailments. What would the advice you give to handle this sort of this sector in where we have had a huge shortcoming in the last 18 months or so, where we haven't been able to be able to cater to that population?
You see, what we have done is, as I said, we're not using common sense at all. We have ignored. Actually, you should have allowed the natural history of the infection to proceed. We have only delayed it by various arbitrary methods. We have only delayed it. I also want to share with you, Dr. Dilshani, that this is the 20th pandemic in the human history. 20th. Yes. Year 2020, this is the 20th pandemic. In India and Sri Lanka, we have a sort of 2020 cricket matches. 2020 cricket matches. We spend our lifetime watching 2020. There's a very interesting thing. We have to wash our hands
agree with you, sir.
20 seconds, we have to wash hands for 20 seconds. So I think what I find interesting about this whole thing is 2020 cricket match, 20 seconds for washing, hand washing. So this is a very interesting story. I mean, it's so evident that a class 1 student who's entering the school will understand. Today's children are very smart, very smart. They will answer the question. You don't have to go to it. But I'm really shocked
I
Now the
agree
whole
with
world
you,
is.
sir.
So I'll just tell you a very interesting story. We come from a culture, Narayani, if you want to make a point, you have to tell a story. Isn't it? In Sri Lanka and India, we have the same culture. To me, these are all
Absolutely.
artificial political boundaries. We are one country. We are one continent. This is a story in Marathi. Sane Gurujinchi Jivan Gatha. This is the story of Sane Guruji. On page 58, Dr. Narayani, there is a paragraph mentioning about 1980 flu, the famous Spanish flu. 1918, 75 lakhs people died because of corona, of Spanish flu, 75 lakhs.
Spanish flu, yes.
And do you know what
Right.
was the population of India in 1918? 38 crores, 38, 380 million.
Right.
7.5 million died. You know what is the percentage it comes to? It comes to 2.85%. And they managed the pandemic very well. In fact, Maharaj of Kolhapur, there was plague that time. They managed it extremely well. They didn't have any of this drama baji that we have. In Hindi, they call it sosha baji. This is sosha baji that's happening. They
Yes,
had
sir.
common sense and they had disciplined people. They used their common sense. Do you know, Dr. Dilshani? In India, 8,000 children died due to hunger. 8,000. Road traffic accident, 4,000. Do you ever talk about it? Does it make a headline?
The statistics.
Does it make a headline? Today,
Definitely.
98% of the news is covered by corona, corona,
Yes.
corona, and showing some
Yes.
exaggerated issues about it. 98%. People have become mad. So I'm calling it as a pandemic of fear, pandemic of anxiety, pandemic of misinformation, disinformation, distorted
Absolutely.
information, incomplete information. That is the tragedy. That is the tragedy.
So I would like to
So,
follow up
if I may ask you,
this
so what is the
statement.
best way?
Sorry?
Go on, please go on.
Yes, Dr. Dilshani,
Sorry, madam.
I
No,
got
Yes,
your
Dilshani,
no,
please
question.
sir.
go on.
I ask you, what is the best strategy to this stigma around the pandemic and, handle the miscommunication and the misinformation that has been translated at a community level, which is a worse pandemic? Regarding
Yeah,
this,
it
what is the
takes
best way
time.
to handle this situation that has occurred with misinformation and miscommunication?
It's very simple. It's most
What is the
challenging in
best way
life.
to reach a community?
I'll tell you the best way. Basically, it's called social and behavioral change communication. You have to change people's behavior. Now, I'll tell you a very interesting flow diagram. I'm very fond of flow diagram. I'm a water engineer. I'm also a carpenter. I'm very fond of tables. I'm also a wordsmith. I develop my own wordsmiths. So what happens is, look at the flow diagram. Knowledge, your information. There's the information explosion. When you type corona pandemic, you'll get tons of information. You'll get drowned, suffocated. That information has to be translated into knowledge. For that, you have to have specialized skills of translating information into knowledge. Knowledge is necessary, but not sufficient. You got to have experience, either field experience, clinical experience, or laboratory experience. So the question, Dr. Narayani, is information flow to knowledge. Knowledge plus experience gives you wisdom. Wisdom. There are three
Right.
kinds of people in this world: those who are wise, those who are wise, and those who are otherwise. And in India, we have a special category: those who supervise. That's very special of India. You employ two people, you employ a supervisor. So when you have got the wisdom, this wisdom helps you to change people's attitude, and that's most challenging.
Yes.
When you try to change the mass of attitude, then the behavior changes. That's where the link is. From information, you go to knowledge, you go to experience, you go to wisdom, you go to changing the attitude, then you change the behavior. And it has to be a sustained change in behavior. That's very challenging. Now,
Yes,
for
sir.
that, you have to understand five behavioral sciences, which are never taught in medical college. Medical school doesn't
Absolutely.
taught. Are you taught psychology,
No,
economics,
sir.
political sciences, social
Absolutely
sciences?
no.
These are anthropology. If you do not know people's what they think about it, how the hell are you going to change the behavior? You have to have these behavioral scientists, psychology, sociology, economics, politics, and anthropology. Tell me which medical school in the world in a subcontinent teaches this subject. Which medical college?
Absolutely
You
none,
went to
sir. This is where we're lacking, actually.
Dilshani came to the All India Institute of Medical Sciences in New Delhi. Dilshani, what percentage of people would you teach us
Yes, sir.
about sociology, anthropology, psychology, economics, and political science? After all, health
No,
is politics.
I
Health
don't
is
know.
politics.
And
Very
would help.
minuscule,
It would have
1%.
actually been quite helpful.
Yeah, maybe you're on a holiday that time when I took the lecture on behavioral sciences.
So that's very true, sir, what you
No,
said.
sir. In community
That
medicine, we had community
uh,
medicine. We had a behavioral science lecture, sir. I remember that in the community medicine aspect
That's because Dr.
in
Panda
your
was there.
department.
That's why we had a behavioral scientist in our department. Dr. Shankar Chowdhury was the first professor. That's because Dr. Panda was there. पांच पांडव में से एक ही पांडव था
Yeah,
तो
and
कौरव
that had a
मंडल से मारा
European
गया
social
और
in psychology. Yes, I do remember.
नारायणी एक
yes, sir.
पांडव 100 को कैसे मारेगा पांच पांडव में
Yes,
से
absolutely.
most important requires Lord Krishna. And you know what is Lord
Yes, sir.
Krishna? Lord Krishna says, you man, you human being, you think you are the master of this world, but you forget about it. You are a transient passenger. You are a transient passenger. Man had become
Absolutely.
very greedy, very, very greedy. Mahatma Gandhi said, there's enough for everybody's need, but not for everybody's greed. Man
Yes,
became
sir.
very selfish, self-centered, greedy, and he has
That's very true.
invited pandemics.
Absolutely.
Overpopulation, utilization of agricultural land, transferring forests into it. You come in contact with the animals, wild
And
animals, and
yes,
they are being affected by viruses. You are responsible, man, the man. I'm also talking about women, but I'm calling the man. You're responsible
yes,
for all this.
yes, sir.
So
Absolutely.
this is a lesson. This is a lesson taught by a tiny virus called COVID-19.
Yes,
You
sir.
better behave yourself.
Absolutely,
Last
sir.
week,
The-
my wife was telling you require 1 milligram of coronavirus to destroy the world. 1 milligram. 1 milligram destroys the whole world.
Absolutely, absolutely, sir. Absolutely. So this is actually a message from Mother Nature that we have actually gone beyond our beyond what we required, and we have actually depleted nature so much that now it's pretty much getting back at us. So, sir, regarding the
Narayani, just a
misinformation,
minute. Just a
yes,
minute.
sir.
1 minute.
Yes, sir.
My Sanskrit heritage, of which I'm very proud. I'm very proud of my Sanskrit language. And actually working for promotion of Sanskrit. There is a slok in Purusha Shoktam. There is a slok which translated in English means when we pray for the well-being of human beings, we pray for well-being of animals, we pray for the well-being of flora and fauna, and we
Yes,
pray for the inanimate objects like the mobile phone that I'm using. What a rich cultural heritage we have that we prayed
yes,
for everybody. And what has happened in the modern civilization in the mid 15th century, I think, the whole thing has just become deeper and deeper, and we are responsible. So this is a
yes,
very polite way to tell the humanity human beings, better behavior effect.
Yes, sir. Absolutely. So regarding the what you said about misinformation and the lack of common sense, this has actually extended into people not being willing to even get vaccinated, and that has actually led to the severity of the disease worsening in this wave. And we have noticed very clearly that people who are vaccinated and then get infected fare way better than the people who have not been vaccinated. So now, sir, there is a lot of debate about the efficacy of the different vaccines available. So, what is the difference in the efficacy of these different vaccines, and how long do you think this effect of the vaccine will last? And will we eventually, yes, we do know that we will need booster doses, but there is always the guidelines keep changing about how long the gap should be between the two doses, and how long the vaccine will actually provide us immunity. So what is your take on this? How often will we need boosters, and what is the actual efficacy of these vaccines?
Very good question. Very relevant. What's interesting is epidemiologists are people who are sent to search of denominator. You're only talking of numerators. Total number of people vaccinated, total number of deaths. In this entire pandemic, you're talking only of numerator. You're not mentioning the denominator at all. This is called floating numerators. In epidemiology, public health, we call it as floating numerators. And you make it sensational that doctors had taken 2 doses of vaccine and he died because of COVID-19. Nobody talks of the collateral morbidity he has. Nobody brings it to focus.
Exactly.
Diabetes, hypertension, asthma, immunosuppression drugs. Nobody talks about it.
Absolutely.
Unless otherwise said, the cause of death is corona. That's the tragedy. Dr.
Yes.
Narayani, that is the tragedy. Now, if you're thinking of youngsters dying in this second wave, so-called second wave. I'm using the word so-called second. Youngsters are dying because of two things. Diabetes, very widely prevalent. India is the capital of diabetes of the world. Sri
Yes.
Lanka is the situation in Dilshani, maybe no different. Hypertension in youngsters, diabetes, and obesity. These are responsible for deaths in the youth population. There is a clear-cut done work by Dr. Amitav Banerjee from DY Patil Medical College in Pune, where he has analyzed the global data and shown a direct correlation between obesity, diabetes, and hypertension leading to deaths due
Yes.
to corona. So, the question that you are asked, I hope I answered it.
Yes, sir.
Numerators, you talk of floating numerators.
So basically, so we do conclude that vaccination is our only way out right now. And I believe I want to send the message that it doesn't really matter which vaccine you're getting, because people are waiting because they don't want the Covishield, they want the Covaxin, or they don't want the Covaxin. So they're waiting. And I believe that this is what is causing problems, and this is what is causing the rise in morbidity due to the infection. And I think this is what I want to say. I always say this to whoever asks me which vaccine is better, so to speak, that it really doesn't matter. It just matters that you get vaccinated in the first place.
Yeah, actually, before we introduced the vaccine, a lot of people got infected. So substantial population has been already covered by natural infection. I totally agree with you that Covishield, Covaxin, what have you, they are basically similar in terms of efficacy. Number three, Dilshani asked me right at the beginning of the program. Second question of hers was, what kind of communication package we created for people? We didn't have any package. I'm working in the field of iodine deficiency disorder for the last 45 years. I have collected frequently asked questions. We have played, that's why I said in the beginning, health promotion, 1% allocation.
Yes.
Strategic protection,
Yes.
20%. 80% allocation for early diagnosis and treatment, which is only tip of the iceberg. The basic concepts of public health have not been followed in this pandemic. Basic concepts. I'm a strong fan of Park's textbook of preventive and social medicine. Today is the 26th edition. You just have to read only 5 pages in that book. I've got them in 5 pages. Dr. Narayani, I have
Yes,
those
sir.
5 pages with me. वो 5 पन्ने पांडव के 5 पन्ने पढ़ लो आपको सारी जानकारी मिल जाएगी सारी जानकारी you get all the information. Dilshani, read those 5 pages from Park's textbook Preventive and Social Medicine 26th edition. 5 पांडव बोल रहे 5 पन्ने पढ़ लीजिएगा.
Okay.
So that's what
I
we
got
want
it.
to. We have always seen that even since the first wave, since this whole pandemic has actually started, people have always been opposed to the ideas that the government and healthcare professionals are talking about. They still refuse to accept general hygiene practices like frequently washing hands, wearing masks, and avoiding contact. These things are still lost on the public somehow, and they just refuse to accept that these things are proven to be effective in preventing the disease. So, how, according to you, should we get this message across to the masses that these things are actually what is helping, not the vaccine and not the actual healthcare system, but prevention is the main. It's the mainstay in helping India come out of this pandemic. So, how do we get this message across?
Three things, Dr. Narayani, three things. First, come back to my ancient culture of which I'm very proud. There are references in Upanishad which tells you how to maintain hygiene. There are shlokas written in Sanskrit which tells you about how to wash your hands, how to carry out ablution activities. We have forgotten that. This was the ancient wisdom. We forgot it. We talk of physical distancing. That concept was also mentioned of physical distancing. Can you imagine? When people used to go to Gurukul ashram, they practice physical distancing.
Yes.
And I get very upset when people use social distancing. I think it's the most asocial, antisocial, derogatory word, this social distancing. I've been shouting from the rooftop for the last 1 year. You know what social distancing means? Dilshani means in India that you are untouchable. So we are all untouchable, all untouchable. I also made a humble appeal to the Prime
Oh,
Minister of
okay.
India, Narendra Modi, sir. Sir, please do not use the word social distancing. It came from 1963. There was a professor of anthropology in the United States of America, Professor Hall. He's the word used, social distancing. And like we are blindly adopted this word, blindly adopted it, social distancing, without understanding what it means in Indian and South Asian context. It's physical distancing, keep 6 feet away. Is there in our is there in the Upanishad, there's a reference to it. So in order
Yes.
to move forward, you must learn what is there in the past, glorious past of India, which I'm very, very proud. I'll tell it in a form of a song. जहाँ डाल डाल पर सोने की चिड़िया बसी करती थी, वो भारत देश मेरा. Dilshani, I'm saying a Hindi popular song, where on every branch there was a golden sparrow sitting.
Yes, sir.
That's my India, that's my Bharat. वो चला गया. Bharat chala gaya. Bharat means
Okay.
give the life.
Oh,
It's disappeared.
huh.
Disappeared. The
Hmm.
word Bharat means one who gives light to the world. चला गया. Colonial rule आया था. Colonialism has wiped out everything. Wiped out everything from this rich cultural past. Now the question that you asked Dr. Narayani, we come back to the same thing with Dilshani's second question is, how seriously have we prepared social and behavioral change communication package? How seriously have we done it? And I don't like you blaming the people. I want to tell you a very interesting framework. I've been involved in Thailand's iodine deficiency disorders work since 1985. That's 35 years.
Yes, sir.
They have a very interesting model in the health where they talk of three things: the triangle that moves the mountain, three S: statesmanship, scientists, and society. Statesmanship, there's a difference between a statesmanship and a politician. Politician thinks of the next election and many times next by-election, while a statesman thinks of next generation. I'm very happy to note that Prime Minister Narendra Modi is a very good statesman. I have tremendous regard for him. He introduced Swachh Bharat Mission, introduced Swasthya Poshan Mission, introduced so many public intervention schemes that affect the hygiene and nutrition status of the population. He did his job. The question came of translating his vision into practice. Implementation is a very challenge. I have an interesting story, but because of time, I won't tell you that. Now come to the scientists. Which scientists are advising the government? You have cardiologists, cardiothoracic surgeons, you have orthopedic surgeons, you have got gastroenterologists. They are advising the government on corona. This is a classical case where you have to run on the ground and the rabbit should be chosen. The public health people, behavioral scientists, management experts, epidemiology, logistic experts should be involved. But whom do you bring on the screen? Cardiologists, cardiothoracic surgeons. They are advising the government. I said last year in my CNBC interview also, I'm promoting CNBC. They took a very nice interview. This is a case where it's a race that has to be run on the ground and rabbit is the best person to win. And they ask the fish to advise. Can you imagine fish out of the water? It can't survive. What kind of advice are they going to give? They can't survive. So that comes to the scientist part. Now the society. Ours is a democracy. Have you asked the people as to what they want to do? Mahatma Gandhi was the first person who started Jan Andolan. When he had the Dandi Yatra, that was the first experience of Jan Andolan, social mobilization. Have you involved the people in decision making? No. Have you involved the elected representative in decision making? No.
No.
So all the three angles of the triangle, only the statesman is there. The scientists are failed us miserably, and as a democracy, societal representatives have not been into consideration. So I'm not surprised that we are in a soup. This is a self-created mess that we have done. Self-created.
Absolutely, sir. Correct. Dr. Dilshani, your next question.
Doctor, if I may, yes, Dr. Pandav, if I may ask you, if India is going to be experiencing the unfortunate third wave, what sort of measures should they take in terms to prevent any sort of catastrophes in terms of what they faced last time? And also, what advice would you give to the SARC region?
Dilshani, I'll take your second question first. Coronavirus has taught us one important lesson. I again come back to my ancient heritage, where what we consider in Indian philosophy, the world is my family. Vasudhaiva Kutumbakam. Coronavirus has taught us it doesn't respect political boundaries, no respect for caste, color, creed, gender, place of residence. It has swept everybody. So, Dilshani, I will not speak of SARC region. Now it's global. All issues are global. Corona has helped us to understand these boundaries have been dissolved. Does it require passport or visa to go from India to Pakistan? Coronavirus, does it require? No. These are man-made artificial boundaries. The map of Africa, you have triangles and squares as countries. Who made them? My colonial friends. They made the triangles and rectangles and circles in Africa. These are all artificial, man-made. And when it's man-made, you are inviting disaster. So I would talk of global now. Everything should think globally, act globally. Think globally, but act locally. Now you have to think of one world, one health. There's a triangle of environment, nutrition, and health. Health, nutrition, and environment. This is the triangle. That's the one world, one health. You have to think of animal health. You have to think of plant health. You have to think of inanimate health as well. So one world, one health. That is the new thing that we have. That Corona has taught us. I consider Corona as my guru. I've learned many things from Corona. Most important, I got time to understand my own ancient scriptures and Ved and Upanishad. हमको time मिल गया. Dr.
Yes, sir.
Narayani, Dr.
Yes, sir.
Dilshani, I used to travel for 200 days in a year. 200 days. I was living in
Wow.
suitcase, visiting 60 countries all over. I visited China also. I visited 12 times. So now this gave me a
Wow.
chance for my inward journey. Inward journey. I did inward journey, and it opened up my eyes. My rich cultural heritage is so strong, so strong. Everything is written in a scientific way. There, it's not just a slope. There is a science behind that. Science behind that, which we had forgotten, which were conveniently forgotten. So there are a lot of things Corona has taught many of us. Most important is that we are one. Vasudhaiva Kutumbakam. The world
Yes.
is my family. Now coming back to the so-called third wave. Same thing, back to basics. Focus on health promotion, health promotion, health promotion. When the Indian budget was presented in the parliament, the Rajya Sabha television took my interview. Dr. Pandav, what do you have to say about our budget? I said the health budget has been increased by 35,000 crores. But I'm most important in two things. What is the distribution of that budget? 60% should go for primary prevention, 30% for secondary, and 10%. But what happens? 90% goes for secondary prevention, 90%.
Yes.
That is a
Yes.
sad story, Dr. Narayani. That's the start. The second thing is budget allocation is the first thing. What about the utilization? There's no utilization is very, very dismal, very
Yes.
depressing.
Yes.
So this has to be linked up. The budget has to be revised, should be monitored every 3 months, I suggested, to understand how best are we using the budget allocated. Whether it's 1%, 2%, 3% of GDP, the distribution of budget is very critical. And historically, since 1947, we have been committing the same mistake again and again and again and again. Focus on the clinical part, which is a tiny part. It's only the tip of the iceberg.
Yes, sir. So that's what we learned in community medicine was exactly that iceberg. I remember that iceberg diagram and how secondary prevention is just the tip of the iceberg, as you have been saying. As Coming to the global aspect of this whole pandemic, in the US right now, the CDC has issued, the Center for Disease Control has issued a guidance that fully vaccinated individuals no longer require a mask in public. So, what is your opinion on this?
Well, my personal opinion, United States is a democracy, vibrant democracy. So I hope they'll understand what I have to say. This is what I call as a tangential solution. Tangential. The most important thing that is produce the mass. You get almost 60 to 70% by using mass, and they have
Yes.
done it with it. That's a very interesting part of the United States of America. This is a question where united we fall, divided we survive. Mask is very important for three reasons.
Absolutely, sir.
Entirely for three reasons. Once, it acts as a physical barrier. The throne of the golden queen coronavirus is the nasopharyngeal region. That's why we wear the mask. The second thing is, on an average, unknowingly, we touch our mouth, ears, and eyes 80 to 90 times. Mouth, nose, and ears, eyes. So I use the word keep men away. That's why you wear mask. Keep men away. Mouth,
Yes.
eyes, and nose. Keep men away. Now people are not using this image.
Absolutely.
That's why you have the mask. And
Absolutely.
United States is a free country. I don't know they in their wisdom, I'm not that wise. There are three kinds of people. I said I belong to the otherwise category when it comes to United States. They're wise people. I'm otherwise.
So
And what
actually,
in mask is in Hindi, that's how we call it mask. Mera aapka suraksha kavach.
Kavach. Absolutely.
MASK. Mera aapka suraksha kavach mask.
So personally, if I were told that I am no longer required to wear a mask in public, I would still not take that advice. I would still, prefer to wear my mask in public. So I don't agree with that decision either. I think it's just paving the way for the third wave.
Dr. Narayani, what the advisors, what do they do? Advisors called, those who advises are called advisors.
Yes,
Those
sir.
who advises are called advisors.
Dr. Dilshani, your next question.
Sir. Yes, sir. Dr. Pandav, if I may take your attention, we have seen there's a rise in COVID cases in the children in countries like Singapore and Taiwan. So, if a situation like that arises in India, what are the measures we can take in India? And is the vaccination of young parents and youth promoted in such a case to prevent such an ordeal?
Actually, they are now clear the vaccine. Those who are more than 18 years can get vaccinated. Now, about the children, the reason, see that another thing that's not been taken, that has not been addressed in Corona. There is always the missing information, incomplete information. What we have is a committee of one person or three people taking decision for a country like India. There is a very established methodology called consensus. Consensus. It's a very well-known document. That's not been practiced at all. Again, it's a clinical approach, prescriptive. Thou shalt do this. Thou shalt do it. You have to approach a consensus method for taking decisions in a situation when there is misinformation, where missing information, incomplete information. It to establish a methodology. I think there has to be a global course on what is public health. Global course on public health, the concepts of public health. The basic ones have become
Absolutely.
acidic. Basic becomes acidic. Now the
Yes, sir.
children have that's going to be a challenging thing if it's affecting children. But again, you have to have the same intervention, health promotion, health promotion. About the vaccine, I'm not sure what is the current opinion about it. Some
And
people
not
are
the
saying,
vaccination of children, but the
where is the
vaccination.
quantity? Where is the vaccine? Where is the quantity? Do you
Yes,
have that much of quantity? You don't have that much of quantity.
Absolutely. Yes,
So
sir.
we are in a kind of a doldrums, we are in a lose-lose situation. All that we have to do is we pray to God Almighty. That's why he said, prarthana karo, prayers. That only will save us. Prayers. And wear the mask. Wash your hands
Yes, sir.
and keep
Absolutely.
physical distance. Keep physical distance. And I would also like to bring here the ancient practice of Ayurveda. Ayurveda should be used. Ayurveda means science of health. What Dilshani, Narayani, what we study in medical college, science of disease. My ancient culture, India's proud ancient culture, as I talk of science of life. So we have Ayurveda, Yogasana, Ayusha, Unani, Siddha, homeopathy. At the age of 70 years, I do yogasana for 2 hours every day. 2 hours. Pranayam is so
Wow.
important, integral part of it. मैं 2 घंटे करता हूँ every year.
Absolutely.
I'm 69 plus. I'll be celebrating 70 years in November. I'll go to Sri Lanka and have a cup of tea there. My
you must. Sri Lanka is
in
the
Colombo.
best.
So, yogasana.
Yes, sir. We're
Again,
100%
ancient
planning.
practice. So, Prime Minister Narendra Modi introduced International Yoga Divas. International Yoga Day. 178 countries supported it. The only resolution in the history of United Nations which has been passed unanimously. 21st of June is International Yoga Day. But
Yes.
that time we didn't, when they call it yoga, when Westerners call it yoga, then you accept it. When you call it yoga, you don't accept it. So I must again compliment my Prime Minister Narendra Modi for having International Yoga Day. International
Yes.
Yoga, not yoga. So now coming to homeopathy, I strongly believe there's only one system of medicine. It's not homeopathy, it's not allopathy, it's not naturopathy. Dilshani and Narayani, what we are missing is sympathy, empathy, and compassion. How much of time you
Absolutely.
spend with taking patients? No sympathy
answer.
and no compassion. No compassion.
Yes, sir.
Sympathy, empathy, and compassion missing. You have 1 minute, 1 minute's time. You say, "Are आपको क्या तकलीफ? What is your problem? Get a CT scan, PT scan, PT scan." And listen to the history. You don't have time to listen to the history of the patient. 90% of information you get by just listening to the history. Listen,
Absolutely. Absolutely.
you have so technology. इसका
I
CT कर दीजिएगा, BT कर CT कर दीजिएगा. Ridiculous.
They do say history taking is an art, sir.
But
So
where is that art? That is disappeared. Disappeared.
absolutely, it's disappeared.
Where is the, I've written an article in Horizon magazine. Horizon. Doctors don't have time to listen. I've written that article. I have written 50,000 pages. How many pages? 50,000 pages on Corona. 50,000.
Wow.
कितने लिखे? 50,000. बट कोई
Sir,
सुनेगा
so
था. मेरी
I
आवाज
would
सुनो. मेरी आवाज सुनो.
so absolutely, this is why we actually wanted you to speak about this. So one more follow-up question that I wanted to ask is, some countries like in the UK and Switzerland and everything, they're working on newer antiviral drugs. So, sir, how much do you think these will help, and how long before we actually see these in India, and how long will we take and how much time will we take to actually use all these measures to bring COVID down to a manageable level?
Your guess is as good as my guess. But before that, I will come back to our own herbal medicine of India. The government of India should encourage herbal medicine here. We have a lot of persons which enhance the immunity. Chawanprash enhances immunity. Ashtagandha. So do work on herbal medicine. I'm coming back again, Dr. Narayan, Dr. Dilshani, that our countries had a very rich cultural heritage. They were scientists, far better and superior scientists. Why? Because they told you about promotion of health, enhancement of immunity. That time there was no vaccine, no drugs, nothing was there. It was related to lifestyle. It was related to the lifestyle of people. Now your question about newer drugs being worked out in Western countries. Recently, our DRDO scientists came out with a wonderful drug. That should be encouraged. I am not very fond of looking to the Western society at all. India has a rich scientific temperament. When I speak India, Dilshani, I talk of South Asia. I talk of Nalanda University,
Yes.
where South Asian countries have come together from Nalanda. I talk of Dakshina in Pakistan, so I talk of
Yes.
Nalanda. We have come together to share our rich cultural heritage as, as different parts of South Asia. Who has made these different countries? Colonial powers, that be, whether it be French or English. उन्होंने हमको बांटा है. So we should
Absolutely.
come back together very strongly. And I'm very proud of Nalanda University. And I'm very happy that Dilshani is making a decision to join Nalanda. Very happy.
Yes.
Nalanda, back to the old age heritage.
No, it would be a
Narayani,
prestige to be part of a university like.
back to basics. Back to basics. And don't be acidic. Back to basics.
No, I agree with you, sir, that the package we have not taken in terms of our Ayurveda and all, which can be brought into the forefront of medicine. And our country is is extremely sad. For all this time, naturopathy and Ayurveda took a back seat, having thousands of years of research, hundreds.
Most important, sympathy, empathy, and compassion has taken a further seat. It doesn't exist. It doesn't exist at all. What you ask is how many charges, it's for commercialization of medical services. In this pandemic, who has made a lot of exploitation. The injections have been sold as 10 times, 20 times, 50 times their price. This shortage is created shortage. Created shortage. So the question of supply and demand, it's created. Why? They want to make money. That's the tragedy. Where humanity has evaporated, disappeared. इंसानियत इंसानियत खत्म हो गई खत्म हो गई. There's an interesting song from Admi, film Admi, very fond of films and songs. I have done a course in film appreciation, and two of my films have got President's Gold Medal.
Wow.
So there are very interesting songs which tell you this. Ultimately, हमको ये बोला है, ए मालिक हम तेरे बंदे, ए मालिक हम तेरे बंदे, हमको बचाओ, हमको बचाओ ये मालिक हम तेरे बंदे. उसके बाद भी नॉट ऑन डिप्रेसिव, इतनी शक्ति दे भगवान हमको, इतनी शक्ति दे. आई एंड माय प्रोग्राम विद इतनी शक्ति दे. सब कुछ लिखा है. Where having used the medium of films and songs to communicate the message on Corona, we have not used it. We have not used the folk theatre. We have not used the song. Very powerful. Bhakti Geet, very strong. जब आप गीत गाते हैं तो आप परमात्मा की पूजा करते हैं. गीत गाते हैं. It's the fastest. It's a bullet train to reach God Almighty when you sing bhajan or geet. I'm working on a field area called musical therapy. There's a club called Indian Institute of Musical Therapy. I'm a founder member of that. Sangeet, Geet, Bhajan. What a powerful way. And I come back to again one more thing. Om. Om is the ultimate mantra. Om. It is the panacea for all needs. And you should say it 108 times. Om. So that means 6 times in a minute. You spend 18 minutes every day, 3 times a day. Most powerful mantra. You know why 108 times? The distance between the sun and the earth is 108 times the diameter of earth. The distance between the earth and the moon is 108 times the diameter of moon. Look at our scientists, 108. There are 108 chakras in our body. Look at our ancestors, so systematic, so scientific, but they were in touch with the nature. They observe the nature. 108 is a very important number in Hindu philosophy. So distance between the sun and the earth is 108 times the diameter of the earth. Distance between the earth and the moon is 108 times the diameter of moon. And there are 108 chakra है. इसलिए हम लोग 108 बार बोलते हैं. That's why we say 108. ये मुझे कोरोना ने सिखाया. Because I stopped my outward journey, I went inside and I realized about my rich cultural heritage, of which I'm very, very proud. Very proud.
So I wanted to ask you, this is it's a change of topic, but so mucormycosis or the black fungus, as it is more commonly known, has basically instilled fear in everybody's hearts now because it has already been declared as an epidemic in Rajasthan, and the numbers increase every day. And as we know, as medical professionals, it was actually a very, very rare disease before this, and we would hardly ever see any cases of mucormycosis. So what do you think is the dominant cause of this spike in cases? Is it because of the use of steroids, or is it because of the immunodeficiency caused by the disease itself? Is it the aftermath of COVID-19 itself?
I come back to the very basic question that we started this conversation. I come back. Standard operating procedures have not been laid. Standard operating procedures. Now, black fungus is a black spot. It's like a black plague. Basically, it's because of lowered immunity. It's an opportunistic infection. Steroids is a wonder drug. But it has to be used with caution. There has to be an adequate antibiotic umbrella, but steroids is a wonder drug. So there are no standard operating procedures. That's why I created another mess. SOP नहीं है, जितना मर्जी दे दो. Sorry, Dilshani, जितना give as much as you can. And
Yes.
there's a new community that it's called the hoarders. They're called hoarders. They hoard oxygen cylinders. They hoard steroids. They hoard Ramstabin. This is a new tribe that has come. New tribe called hoarders. So basically, coming back to the music, there are no SOPs. Second thing is the maintenance of oxygen plants in the hospital. How many times have they cleaned it? What is the frequency? Do you have a set pattern? No. So there are opportunistic infections. The whole story is opportunistic infections. That's why it's happening. So it reminds you of black plague, black fungus, black spot on the history of corona, COVID-19, black spot.
Yes, sir. Basically, the message that we want to give is that India famously managed the so-called first wave very, very efficiently, despite the population density and the lack of healthcare resources even in the beginning. We still managed COVID. Apparently, we were more efficient than the other countries, and we saw a dwindling number eventually towards the end of the year last year. And probably it is because we gave ourselves a pat on the back too soon, and we just were overconfident that no, we have defeated this disease and we have basically come out of the pandemic. So probably it was this overconfidence that has led to the second wave, and us not being prepared for it again, because as you said, we still, despite being a year and a half into this pandemic, we still don't have our SOPs ready. We still don't have a fixed way to handle the complications that come from the disease. We are facing newer complications and probably worse complications, because mucormycosis causes a lot of morbidity. It causes people to lose their eyes, and very extensive surgeries have to be done to get rid of this disease. So this is probably where we are lacking, this overconfidence that we had and this lack of planning, as you said, that we had in even after the first wave, is probably why this second wave has actually been worse, is what I feel. Dr. Dilshani, do you have another question?
I totally agree with you, Dr. Narayani.
Yes,
I
doctor.
totally agree with you. Again, Dilshani's second question. Social and behavioral change communication was missing. We celebrated too soon. Celebration where we should have been warned.
Yes.
Patience, patience, patience. Patience, patience, patience. We're fighting with the unknown warrior. Unknown warrior. We didn't know what was happening. Did we know what kind of a creature is this corona COVID-19? हमको नहीं पता था. Patience, patience, patience. Perseverance, perseverance, perseverance. Resilience, resilience, resilience. Social and behavioral change communication package was missing at all levels. Look at our own interview. You people have spent 70% of time. You're smarter. Two ladies are smart ladies. 70% on clinical questions, 30% on publications. 60-40. I'm 60-40. 60% on clinical questions, 40% on publications. Because ladies are there. We men are part of the problem. It is the women who are part of the solution.
So if I can just touch on one key thing, sir. So India is known as but during the COVID crisis, it faced a lot of problems due to, let's say, supply chains. It's a reason in terms of the next 5 years, or in terms of handling the next catastrophic event that can take place. What would be work in this region to ensure that sort of resiliency is maintained within?
Actually, there was I couldn't hear your full question properly. Can you
Yes,
say
sir,
that
I'll
again,
repeat
please?
it. I'll repeat it, sir. India is known as the world's pharmacy because of the massive production of drugs and vaccines that happens in India. But now, in this wave, we have noticed that there are very huge and very significant supply chain and delivery issues of these drugs and vaccines in the pandemic. So, how can the whole region come together cohesively and in a collaborative manner to increase the resilience across this whole region when it comes to um, the issue of drugs and vaccines being completely unavailable or very inaccessible to the public?
The answer is very simple. Jan Andolan, social mobilization. Our people may be poor economically. Poor, I'm using the word poor economically. They may be poverty of money, but not a poverty of ideas. The best practitioner economists are the poor people. They know how to survive with limited resources. Have you involved people in this exercise? Have you involved them? No. When we got freedom to the Dandi Yatra Salt March, first experiment of social mobilization, we forgot it. There are
Absolutely.
136 crore healthcare workers. I will call them healthcare workers. 138 crores. So don't talk about shortage of healthcare workers. We have not involved the people at all. Our approach has been prescriptive rather than participative. Prescriptive. Thou shalt take. Classical
Yes.
clinical approach. Classical
Yes.
clinical approach. No question of participation, only prescriptive. So I would say
Absolutely.
mobilize the entire community. Jan Andolan, social mobilization. I'll tell you a story since this one is from Sri Lanka. In historically, the first example of Jan Andolan when Ramchandra was building a setu across India from Rameshwaram to Sri Lanka. Even the squirrel participated in that squirrel. That was the first historic social mobilization. Even the squirrel participated. Squirrel. So involve everybody. Everybody is a healthcare worker in India, in Sri Lanka, in Nepal, in Bangladesh, in Bhutan, in Pakistan. Everybody is a healthcare worker. Nahi kya hai? You don't involve people, so you
Yes,
get
sir.
the results of that.
So we do actually have a question that says, considering our mistakes and the fact that we have been overconfident, what corrective measures do you suggest for India and the other Southeast Asian countries?
Back to basic. Go for introspection. That thing is,
Absolutely, sir. I feel the public does not take the onus upon themselves, and they feel like the responsibility is of the government to protect them from this pandemic. Of course, the government should be able to guide the common man, but at the same time, everybody as an individual should also be involved in preventing the disease and actually being a responsible citizen. And even if they do have the disease, they should prevent its spread. We still have so many people who hide their symptoms, who hide the fact that they have a positive report, and then they move around in public
again,
and everything.
Narayan,
So,
so sorry to cut you short. Again, social and behavioral change communication and basic levels of
absolutely.
primary and secondary prevention. You know, one interesting thing is that we are back to basic again. I started the discussion with that. We are back again at the same spot. If you do the same thing again, you will end up doing the same thing. Get public health professionals, epidemiologists, behavioral scientists, management experts, logistic experts into action. If you continue to involve clinicians in managing a public health problem, you will continue to face the same disaster. It's an invitation. It's an invitation. And people's have faith in your people. People's participation is very important. Very
Yes.
important. Don't be prescriptive, be participative.
Dr. Dilshani, do you have any more questions?
No,
Dilshani,
thank you
Dr.
so much,
Dilshani,
Dr. Pandav, for all your amazing input on this.
Dr. Dilshani, wait a minute. This whole story is not story of hospitals, not story of
Yes.
healthcare workers, not nurses. It is a question of social justice. It's a question of social justice. It's politics. Health is politics. Rudolf Virchow said that in the 18th century, health is politics. And now health is politics on a larger scale. Here the politics is of making profit. It's criminal. Humanity has evaporated. People are after profit. And the old brothers are dying. They're making money. This is Kali Yuga. Dilshani, Narayani, this is Kali Yuga that we are living in. Kali Yuga ka hi zamana hai. Kali Yuga hai.
Yes, sir. Very true.
Hmm.
So I had said in the beginning that when it comes to global health, there is no them, it's only us. So I believe that through this entire session, the message that we want to put out to the general public is that it's not anyone else's responsibility anymore to protect you or to protect the society or the country or even the world in general. It's supposed to be everybody's individual responsibilities. So when we say wear a mask, wash your hands, and everything, people need to realize that that is not political, that is not propaganda, that is very, very basic measures that have been proven to prevent disease. I mean, ever since we started wearing masks last year, we haven't even got the common cold, like not even allergic or the common flu. So it's very, very obvious the effect that these protective measures have on our daily life. So that is the message I believe we want to give to the general public.
Dr. Narayan, Dr. I repeat what I said in last year's interview, 5th of June. The good thing about the past, it is over. But we must take the learning from past in future. History tells us that if you do not read the history, you'll keep on continuing committing the same mistakes. Read the
Yes,
history. It is his story, not her story also. It's his story. It's not a mystery. You read the history. And it's not a question. I belong to the school of not either or. It's and. It's and. That would be my message. Hum saath hai. We are together. We are together.
absolutely.
We are together.
Right.
There may be diversity, but you are united. That's what again back to my proud culture and heritage. Go back to the past. Go and read Veda and Upanishad. We celebrate the diversity, but you are united. United we stand. Togetherness. Not
Absolutely.
I and you. It's us. You can put it in mathematical equation. It's not I and you. It's equal to yes. Yes, we, us. So that's the
Yes.
story of we and we and we.
Yes, sir. So I would like to conclude saying that we basically have to believe in these practices that have been a part of our ancient history. We have, for many, many thousands of years, been practicing this in our cultural system completely. We were the pretty, like the most forward civilization, and I believe that there was a reason behind that. So we need to go back to our history and understand the science behind it and understand that we need to follow those hygiene practices even now. And they are now more important than ever. And another thing that Dr. Pandav said, that common sense has been lost on people. And we need to bring that back into our lives as well. Um, Common sense has to be a huge part of how this whole pandemic is going to be dealt with. The wearing masks and social distancing is just, sorry, not social distancing, physical distancing is 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 a part of so physical distancing, wearing masks, and being generally hygienic is just a part of common sense. Also, believing in the efficacy of the vaccine, because that again is not propaganda, it is not political. These are some basic things that we need to follow to be able to deal with this pandemic now and to prevent the so-called third wave that we are expecting. So, sir, thank you so much for taking out the time to be with us today. And thank you, Dr. Dilshani. It was very nice meeting you and having this session with you. And I hope we can, yes, sir.
Yes, of course.
तो कोरोना कोरोना ये क्या किया तुमने चमत्कार, कोरोना कोरोना ये क्या तुमने किया चमत्कार, आजकल सारी दुनिया करती है एक दूसरे को नमस्कार.
Yes, sir, absolutely. This is the biggest
Namaskar, Namaskar is Yoga Mudra. You do Anjani, this is Anjani. You bring your hands together, you go down and smile. So I'm communicating, my Atma is communicating to your Atma, that we are part of the same Paramatma. That's why now, but Indians have stopped laughing. You know, हम लोग से रोते रहते हैं, मुझे हंसते नहीं. You must remember, laughter is the best medicine. Laughter, हंसते रहिए, हंसते रहिए, हंसते रहिए, हंसते रहिए. Laughter is the best medicine.
That is such a lovely message, sir. Thank you so much for taking out the time. And we hope we can speak to you again soon. Thank you and good night.